The prognosis. Senate Republican Conference Chairman John Thune RSD. AP photo. Pablo Martinez Monsivais. Obamacare is often referred to as a three-legged stool. Americans must buy health insurance, insurers must sell them generous benefits without discriminating, and the government provides subsidies to help pay for it all. Using that metaphor, let us consider how Senate Republicans have struggled to pass an Obamacare repeal bill over the past 2 days. First, Republicans tried to chop off all three legs with a bill replacing much of the Affordable Care Act. That failed Tuesday night. Then, they tried to chop off just the first and third legs, the individual mandate to have coverage and the subsidies, in a repeal-only bill that failed yesterday. Now, they read down to a third potential option: chop off just one leg, the individual mandate, and leave the stool lopsided. Number 3. Senate Republican John Thune said yesterday that they were edging closer and closer to 50 votes for this skinny repeal option. My colleagues Juliet Eilperin, Kelsey Snell and Sean Sullivan report. Details are still emerging, and could always change quickly, but the aim is to pass a bill repealing just the ACA's individual and employer mandates, its medical device tax and its public health fund. Funding for extra Obamacare subsidies for cost-sharing discounts may be attached to, and the legislation may also retain a provision blocking Medicaid reimbursements from Planned Parenthood clinics. Once passed, the bill could be sent to a conference committee where members of the House and Senate could hash out an agreement. Leaders are betting Republican senators who defected on other votes this week would feel enough pressure at that point to support whatever the final measure looks like. Kaiser Family Foundation Senior Vice President Larry Levitt noted that it could look very different from skinny repeal, but if Senate Republicans voted for this skinny repeal today or tomorrow, they'd be backing policy that would undermine the already shaky individual insurance market, result in fewer covered Americans, and drive up premiums. Here's what is likely to happen under the skinny repeal approach. Without the individual mandate to buy coverage, some people, disproportionately healthy ones, would opt out of health coverage, worsening the risk pools and driving up premiums. According to new Congressional Budget Office estimates released last night by Senate Democrats, 16 million fewer Americans would have health insurance next year compared to current law, and individual market premiums would increase 20% on average, although the proposal would save the government money because fewer people would be enrolling and accessing subsidies. You're talking about cutting one leg off a three-legged stool, Linda Blumberg, a senior health policy fellow at the Urban Institute, told me. Keeping the subsidies in place, the stool may be able to rest on the stump and not completely fall over, but you are going to see the effects of that by significantly higher premiums. Granted, Obamacare's individual mandate hasn't worked as well as everyone originally thought. Many analysts concluded the penalty for failing to buy coverage is just too small, set at either $695 or 2.5% of one's income, whichever is higher. That's much less than most people would pay in monthly premiums over the course of a year. Plus, the government has few tools for